Good morning, everyone. Today we're going to talk about the Rubrospinal tract. Okay, Rubrospinal tract, which is this tract right here. So this one is a descending pathway in the central nervous system, and that will originate from the red nucleus, which is this structure here, and this structure is actually located in the midbrain. I think that this is relevant for your studies. So, guys, this tract will be important, okay? It plays a crucial role in motor control, especially in coordinating voluntary movements and postural adjustments. So before I continue with this presentation, I'm gonna just complete this drawing. And I've been making these videos about neuroanatomy for a while now, and if you would like me to approach a different topic, please let me know. I'm happy to do this. And okay, I was thinking about talk about the digestive tract and the heart as well, but I would like to know your opinion. What do you think? So, as I mentioned before, this structure here, okay, is the midbrain. Let me just use another pen. This is the midbrain. Okay, and this one is the red nucleus. What do you think about this pen? I will do with this pen today. Might be better for you to read, or even to take a screenshot. Nucleus. This is the red nucleus, and this one is the Rubrospinal tract. Okay, so we have here the Rubrospinal tract, and as I mentioned before, arises from the red nucleus, which is this structure here within the midbrain. And the red nucleus will receive input primarily from the cerebellum via the dentate nucleus and also from the cerebral cortex. And this impulse will help to modulate the movement coordination and posture. So, as you can see here, after originating in the red nucleus, the fibers of the Rubrospinal tract cross over here to the opposite side of the brainstem. This is called decussation at the level of the midbrain. And following the decussation, if you see, the fibers descend through the lateral funiculus of the spinal cord. The lateral funiculus is one of the three major divisions of the white matter in the spinal cord. I already mentioned about the lateral funiculus. I recommend you to review or to rewatch the video on my YouTube channel. And it is responsible for transmitting signals between different levels of the spinal cord and the brain. And it will terminate at the Rubrospinal tract, okay? Actually, the Rubrospinal tract, terminates on the anterior horn cells in the spinal cord, right here. This is the anterior horn cells. And the anterior horn cells, you probably remember, are motor neurons that will innervate skeletal muscles and will control their contraction and relaxation. So by influencing these motor neurons, okay, the Rubrospinal tract helps to regulate the muscle activity, and it will also contribute to fine motor control and posture stability. So this is determination of the rubrospinal fibers. Termination of the rubrospinal fibers. Okay, so let me just complete this drawing here. You might be asking yourself what will happen in a situation where these structures are injured. If you're not asking yourself, you should. Let me just finish and then I will tell you. Okay. So, rubrospinal tract is involved in modulation of muscle tone and coordination of voluntary muscles. And it works alongside other descending motor pathways, as I mentioned again about the descending motor pathways in another video. You can have a look at this video, such as the corticospinal tract, and it will ensure smooth and precise motor function. Injuries, when damaged this area, it can result in impairment in motor control and postural adjustments, causing spasticity. So injury to the rubrospinal tract usually can lead to increased muscle tone, which will happen due to disrupted inhibitory influences on the anterior horse cells. Postural instability, because since the rubrospinal tract helps maintain balance and posture, damage to this pathway will contribute, actually, sorry, I heard a noise here, can contribute to difficulties in maintaining an upright stance or performing coordinate movements. And there are also pathological conditions that disorders that that in some way can affect the rubrospinal tract, and usually these disorders affect this tract, and is quite common in conditions such as conditions that impact the midbrain or even the spinal cord, such as traumatic injuries, strokes, or even degenerative disease like Parkinson's disease. In Parkinson's disease, dysfunction of the cerebellar cortical red nucleus circuit can indirectly affect the rubrospinal tract, leading to motor deficits. And yeah, this is, I think that I explained everything that I know right now about this topic. I can probably revisit this topic in the future, because I believe that we have a lot of things still to explore here, and pretty sure that a lot of studies are happening at this moment. And if you like this topic or this content, please consider to subscribe, share this topic with another person. Please, if you want to suggest something, feel free, and I appreciate your time here with me, and see you next time.